So it sounds like you all have had a lot of experience and a lot of success when someone comes to you who is overweight, who's got type 2 diabetes, who's trying to prevent heart disease, who's trying to prevent stroke. What has been your experience when people come to you and have cancer or gastrointestinal issues? Have you been successful in helping them? Is that something that's just not part, doesn't, lifestyle and nutrition doesn't make a difference? In other words, when people come to see you, instead of saying I have heart disease or obesity, they say I have cancer or I have gastrointestinal issues. What has the success been with a very strong whole food plant-based diet and healthy lifestyle?
I mean, probably Dr. Fuhrman treats more of those patients than either Dr. Williams or I. I'll just say, the data is very strong. Again, the word microbiome. Take a poor, standard, urban American diet, transition for 2 weeks to a plant-based diet, remeasure very advanced parameters of our gut health, our metabolome, our TMAO levels. You can transform your gut into a much healthier gut in 2 weeks by whole plant-based foods and eliminating processed sugar, poor quality fat rich food. So all of us, experience better gut health. And some people actually resolve a lot of clinical issues. But I'll leave, cancer in terms of my comments to probably Dr. Fuhrman.
Yeah, I could say that my recent book, Eat for Life, talks a lot about that. And I've had a lot of experience with cancer patients over the years. And I have to say that that I think the scientific literature supports this concept that the same foods that show maximum protection against getting cancer, that's where we're talking about green cruciferous vegetables and eating scallions and mushrooms, these same, including flax seeds and all these powerful foods that have anti-angiogenic and estrogen favorable effects. And so what I'm saying right now is the same dietary portfolio that prevents cancer has been shown to be effective in the scientific literature at increasing lifespan and preventing recurrence in people who already have cancer. For example, a study on following women who had breast cancer for a decade showed that those with 1/3 of a milligram of lignans from flax seeds or chia seeds every day on the average had a 71% reduced risk of mortality over that 10-year period compared to women not having flax, those lignans in their diet. Likewise, we have lots of studies on people with cancer followed for decades showing that dietary manipulation does afford them an opportunity to live longer and have lower risk of cancer recurrence. So diet does make a big difference when people, it's not just preventative, it extends lifespan with people who have cancer. I gave so many case histories of people who were given 6 months to live with metastatic ovarian cancer and all types of diseases who have now been alive 17 years, 20 years later. And I gave so many of these case histories on my PBS television show that PBS wouldn't let me show them. They cut them out of the show. I had them on the stage and I had the people interviewed going through, they recovered from MS. I got rid of my colon cancer. I got rid of this cancer. But they pulled it out of the show because they felt it was too unbelievably. And all I'm saying is that why not go all the way when you have a disease? And I think, Dr. Williams and Dr. Kahn are saying too, when you have a person who you determine at high risk for heart disease with some measurements, you go out with all the stops and you intervene radically and aggressively to get them to change their diet and do everything to protect themselves. And I'm saying the same thing is true with any disease. When a person has psoriasis or an early stage cancer, sure, there's lots of cancers that are not going to be impacted. Like there are certain cancers that are difficult to get to, or certain cancers that as they become more advanced, you're not going to affect a person's lifespan that much with dietary manipulations. Obviously, the earlier the stage of disease is, hopefully before a person even has cancer, and then they're in a precancerous stage, they're in an early cancerous stage, they're in a moderate, the more the disease advances, the harder it is to expect any predictable or any predictable response. But that doesn't mean the effort should not be there and that we don't see lifespan enhancement and lifespan benefits for people who are using aggressive nutritional interventions who have cancer.
But for the people, when you said that a person got better, was that 1 out of 1,000 or 1 out of 10? Like how common is it? I mean, when people come to you with cancer and you treat them, does 1 out of 3 get better? Does 1 out of 3,000 get better? Like, how realistic is it? It's okay if it doesn't work, but I just want to set a realistic expectation that we know that when people are 30 pounds overweight and they go on a 20-day water fast, 100% lose weight. If people, have an early stage cancer and they go on a great lifestyle and diet, does 50% get better, or does 1 in 100 or 1 in 1,000?
Well, in about 50 years, I can give you more information about that. It's a joke, but the point I'm making is that, my experience of the last 30 years has been like, take a man with prostate cancer. The lower his PSA and the earlier he comes to you with the early stage of cancer, the more likelihood his PSA is going to come back to normal and he's going to have no residual determination of prostate cancer. But the further it advances and the more advanced he gets, the less you may improve his quality of life and improve his lifespan, but you're not going to be a total curative at that point because the cancer is too advanced. So you can't give a general answer to that question. I could say this. I'm not an oncologist, and I don't primarily see cancer patients. But since I have seen hundreds of cancer patients that have followed my approach over the years and seen an astronomical number of people with long-term benefits that can't be denied, I think I'm astounded by the results, but nowhere could I make any definitive claims or judgment based on percentages or numbers. I could just say my observation of seeing so many individuals who were in an unfortunate situation are able to get well again and to live longer and do much better. And many of them, like I said, including I have a couple of women patients who had metastatic ovarian cancer who have no residual cancer. Now it's been almost one case 15 years and one case more than 20 years. And I have lots of people with you could say early with breast cancers that were in earlier stages that are now living 10, 15, 20 years later and thriving. But I really don't have the studies or data to support anything like that because I was a primary care physician moving from patient to patient, doing the best I can to help them, and not a primary researcher taking in a whole series of cancer patients and seeing the outcomes and spending millions of dollars to try to determine the efficacy. I'd love to see those studies done, and I'd love to be part of that and put my input in. And I do advocate and work with researchers in trying to do studies like that, but obviously the data is not available.
And Steve, I'd just add in, going back to the agreement there is among so much of the conversation here, that there's a single lifestyle that affects so many things, from Dr. Bredesen's brain interest, who's now left. But about 2 months ago, there's a study called PREVEND, and the Journal American College of Cardiology, Cardio-Oncology. If you follow a heart healthy lifestyle, you don't smoke, you get fit, you eat your vegetables, you monitor your blood pressure, your blood sugar, all the things Dr. Williams talked about, the big 7, your future risk of cancer goes down phenomenally because it's phytonutrients and it's oxidative stress and it's inflammation and it's weight and sleep. And if we will get this group listening and larger groups to follow a heart healthy lifestyle, we will reduce not just heart attacks, but we will reduce cancer risk for sure. But it's it's not one thing. It's not sprouts, and it's not just green juice. It's trying to manage and juggle day-to-day life with a whole lot of other factors. But do the best you can.
Okay.
So if I can just put a finer point on that, I don't have a practice, but living in the United States, of course, I've had friends who developed cancer, did the chemotherapy, went plant-based, being followed with scans for metastases, and everything looks stable. And as they lose the weight on the plant-based diet, the oncologist tells them, you have to eat meat, and then had the cancer take off. And so I understand that higher cholesterol promotes cancer, more obesity, adipose cells promote cancer, and IGF-1 from animal protein as well. So I'm hoping, Dr. Fuhrman, that people will do prospective randomized trials. There's a little bit of momentum. I've seen this on the MD Anderson website, seen it on Sloan Kettering's website, the Mayo Clinic, that people are supposed to be eating predominantly plants. But they're really talking about prevention. And I hope that they can sort of spread that word throughout the oncology practices so that we don't have to see this astronomical sudden increase in metastases when people start eating animal products, unless these are just a couple of 2 or 3 cases that are anecdotes and they're not really meaningful. The only way to know that is prospective randomized trials.
Yeah, and I agree with you. I think that's what we're going to see. That is that certainly eating healthy, whether people get surgery, chemo, radiation, whatever happens to them, if they stay eating healthier, they have better long-term outcomes than groups that don't. There's no definitive effect for each individual person is going to be different, but at an aggregate scale, if people adopt a very healthy way of eating, they're going to have better long-term outcomes.
Okay,
I'm sure the
last
studies will eventually show that.